Welcome to session 3 of the MSU Extension School of Planning, Design, and Construction Land Use Team's Resiliency Planning webinar series. Today, we're going to learn about and discuss the intersection of climate adaptation, economic health, and public health. So welcome. And my name is Harmony Gamazel. My pronouns are she and her, and I am an educator with MSU Extension, and I'm based out of Washtenaw County, serving Southeast Michigan and Mid-Michigan. So it's my pleasure today to be the moderator for this esteemed panel. Today's webinar is the third in 6 sessions of this Resiliency Planning webinar series. We do hope you have been enjoying the last 2 sessions. If you have missed those, they are recorded, and we will make those links available to you. So we're looking at disruptive events like climate change and the pandemic and how those really impact regional economies. That's the overall mission of this webinar series. And so we hope that the thinkers and doers across the state of Michigan and in the Upper Great Lakes, who we know have been joining us, you are able to take away tools and inspiration and additional readings from each session. And I feel like this session will be no different. We have a fabulous panel with a lot of experiences to share and tools as well. So let me introduce today's panel: Wayne B.A., Emily Leach, and Aaron Ferguson. So Wayne B.A. is a faculty member and senior specialist in outreach at the MSU School of Planning, Design, and Construction. He directs the American Citizen Planner Collaborative, which is an online training program for planning officials nationwide in partnership with land-grant universities. In addition, he's the national leader for the land use planning community of practice through the USDA's Cooperative Extension Service. Emily Leach grew up in the Chicago area, graduating from Northern Michigan University with a degree in environmental studies and sustainability with a minor in Native American studies. She spent 6 years with the Superior Watershed Partnership, coordinating a low-income energy assistance program, implementing renewable energy and energy waste reduction projects. There are numerous habitat improvement projects as well, having to do with coastal and climate change mitigation and adaptation projects across the Upper Peninsula of Michigan and through the management of the Great Lakes Conservation Corps. Emily transitioned into local government and has been with the County of Marquette Planning Division since 2019, focusing on projects related to community development, recreation, and forestry. She is the chair of Marquette County's Climate Adaptation Task Force, where she promotes collaboration within climate adaptation projects with a wide array of partners. So welcome, Emily. Welcome, Wayne. Finally, we have Aaron Ferguson. He's the manager of the Climate and Tracking Unit at the Michigan Department of Health and Human Services, which brings together the Michigan Climate and Health Adaptation Program and the Michigan Environmental Public Health Tracking Program. The Climate and Tracking Unit is working to develop a cross-sector data-driven response strategies that are needed to protect public health from existing and several emerging environmental health threats, which are exacerbated by social and economic inequities and magnified by climate change. Aaron does hold a master's degree in public administration with a focus on urban and regional policy and planning, also with a degree in natural resource management and a minor in economics. So welcome, panelists, and we do look forward to hearing what you have to share with us today.
Thanks, Harmony, and good morning, everyone. It's a pleasure to be speaking with you here this morning and to be part of the panel here. It's a really important topic, timely topic that we're going to be covering here this morning in some different phases. I'm going to start off by giving kind of an overview of some of the work that we've been doing around climate and health adaptation. Aaron will get into some of the more detail at the state level on climate and health, and Emily then will lead us through some local case studies and the local experience in Marquette. The next slide, please. Just wanted to acknowledge some of the work that we're going to be talking about here was really over the last 4 years, number of partners. We've had a grant through the Centers for Disease Control with the Michigan Department of Health and Human Services and Aaron's team. And as Harmony had mentioned, our School of Planning, Design, and Construction and MSU Extension. And as Emily will demonstrate, a number of local partners. And we've had some technical expert peer reviewers for the material that you're going to be seeing here today. So I think before we get started too much into the weeds, some of the topics that we'll be talking about here, we're going to be focusing on climate and health adaptation. And one of the important distinctions, fine distinction between climate adaptation and climate mitigation, just wanted to highlight that a bit. So when we're talking about climate adaptation, we're really talking about those impacts that are already being recognized by a climate that is changing. Whereas in mitigation, you certainly could be addressing those aspects, but you're really trying to reduce or eliminate the cause of climate change. And just, I'm not going to go over this in detail. Aaron will cover some of these components, but just so that we have a sense of some of the impacts that we're talking about, whether it's air quality, extreme weather events that have been in the news quite a bit, water quality and quantity, and some of the ecosystem changes. But just taking a look at, for instance, that extreme weather events, as we have rise in atmospheric greenhouse gases, rise in temperatures, changes in precipitation, that could lead to some of these extreme weather events that we've all been seeing over the last couple of years and beyond. An example would be exposure to heat waves, some extreme cold. The example in Texas that we've seen here recently, and some really extreme weather events, and some of the health outcomes, whether it's everything from heat illness, cold-related injuries, and worsening existing cardiorespiratory illness, asthma that we see, and some of the mental stress that's been documented. So we've basically, after the case study and the experience that we had in Marquette County, and I'll talk a little bit about why Marquette County was chosen initially as our pilot. But after that 3-year experience of working in Marquette County, the thought was, let's put together a guidebook that can be used for communities throughout Michigan to address some of these concerns and how it can be integrated into community and economic development plans, master plans, and other plans at the local level. But part of it is to provide guidance that incorporates health perspectives. A lot of times, the planning initiatives don't necessarily have epidemiologists, health experts working with planners and economic developers, community development agencies on some of these key aspects. So that's one of the key aspects. The other is working with small communities. A lot of the literature, a lot of the experiences of big cities, whether it's Boston, Chicago, Seattle, Denver, communities that are large that are working on these. And some of the experience and recommendations aren't necessarily tailored for small or medium-sized communities, many of which we have here in Michigan. The guidebook really focuses on four key parameters that we want to be able to talk about. And certainly the topic of this session focuses on equity and economics. So that is a key component, but keeping health and equity at the forefront of all action. We've seen where when we have these extreme weather events, those that might be without transportation options might be more greatly affected, and others that are in unique circumstances. And also, really this engagement that needs to take place. I mean, that's a good part of any community development, but it's particularly important when we talk about climate health adaptation and getting the different perspectives around the table. The other important aspect is to be able to use some relevant data so that we're ground truthing some of the experiences and ideas and concerns that are being expressed. And finally, this leveraging visualization tools. When we talk about climate change, it's one of the difficulties to kind of get your arms around it. People might think, well, gee, this is something at the global level. What can I possibly do at the local level to even effectuate some of this change? And using some of these visualization tools to bring it down to the local level and to be able to help explain that is really helpful. Next slide. So I'm going to get through just a few aspects in the guidebook. Harmony and the team here will put the link in the chat on where you can find these resources. They're also listed on a couple of the slides. But if you want to take a sneak peek under the lid, I'll be talking about 4 documents. But this main document here is this climate and health adaptation guidebook. Next slide. And we really highlight in the guidebook these 4 different phases. Now, you might look at this and say, okay, well, this is a pretty standard, planning, community development type process, which is certainly true. There's components in each phase that we've customized for the climate health adaptation component to it. I'm not going to go through all these in detail here now. I'm going to give an overview of each of the phases, but just briefly here to kind of give the overview. When we talk about engagement, any of you that have been through charrette training or some of these community workshop, vision workshop, design workshops, know how important it is up front before you actually have your kickoff meetings to really engage and meet with a diverse group of stakeholders. And that is certainly true and important when we talk about climate adaptation work. The phase 2 really gets into that community engagement using visionary tools and design tools, and then really taking that the next step into getting into some of the prioritization and implementation. And of course, any good process, particularly when we look at climate change, we have some metrics that we put together and policy, and putting together a plan on how you're going to monitor and update and say, are we moving the ball on any of these aspects? Next slide. One key aspect of that pre-workshop is to understand your audience. We often say that in community development and in land use planning, but certainly it's true in climate and health work. There's this study that's been done every few years by Yale and its partners called the 6 Americas. And the idea here is to identify where your audience is when we talk about climate change. Everything from one end of the continuum being very alarmed and concerned, like, why aren't we doing something yesterday, to folks that might be doubtful or dismissive and say, well, this is really not an issue, and why are we focusing on it? So it's important before you start some of the work to understand kind of where the different perspectives are. And some of the work that we've done around the state, we use this survey to kind of gauge where folks are at the beginning and end of the process. Next slide. So now let me take you through a few of the phases. Next slide. When we talk about the engagement phase, it's really bringing together a diverse group of stakeholders. Maybe not some of the typical. I know me personally, I had worked with very few epidemiologists and healthcare professionals in a lot of my planning and legal work in community and economic development and land use planning. So that to me was an interesting aspect to be able to understand the language, and meeting with homeless shelters and veterans groups and other aspects of the community that at least in some of the work that has been done over the years are perhaps groups that aren't necessarily where folks reach out to. Next slide. As we've mentioned, kind of our perspective has been on Marquette. And when we were looking around the state with this CDC funding and Michigan Department of Health and Human Services, we wanted to be able to identify an area that had already done some work in this arena, and to be able to see, who is perhaps in a good position to take things to the next step. And clearly Marquette County and some of the things that Emily will be talking about were key to this. In particular, that there's the Superior Watershed Partnership and some of the work that's been done for the Lake Superior watershed, Marquette County that had been very instrumental in some work, and the city of Marquette that had put together climate adaptation planning work into some of their master plan work. So they had some of the background infrastructure and a steering committee in place. Next slide. So the work over the last 3 years was broken down into several phases, which we've then put into the guidebook as an idea for you to be able to move forward with this similar type of work. Some of this follows a typical process, but that phase 1, the better part of the first year, was really to meet with all these different stakeholder groups and hear what the perspectives were. We didn't come in with data and science and said, this is how the climate is changing. What do you think? We took it from the perspective of, what are some of the issues that you're seeing that you think are of concern, and then trying to match the policies and metrics and data to help support some of those issues. Phase two was really then getting into some of the recommendations and issue identification, and using a design workshop as a way to help move that forward. And then the phase three was where we really spent the better part of the few months going through some of those prioritization and having work teams put in place to be able to move it after we backed out and moved out of the community. Next slide. So as the link that was put in the chat, these are the different materials. The one I'm talking about primarily now is that Climate and Health Adaptation Planning Guide for Michigan communities that was announced recently by Governor Whitmer, and Aaron will be talking a little bit about that executive order that came out a few months back. But there's 3 companion documents I just wanted to mention so that you don't get confused or understand. There's this volume 1, 2, and 3 that really takes a deeper dive into some of the stakeholder engagement, the policies and metrics that were used to, in particular, to the Marquette County process, but they're applicable statewide. And then the experience from that was put into that Climate and Health Adaptation Planning Guidebook. Next slide. Just to give you an idea of some of the broad stakeholder groups that were brought in the Marquette County, everything from climate change groups, public health officials. We met with a number of emergency preparedness and underserved groups. Like I mentioned, we literally visited a homeless shelter and talked with some of the staff and to learn a little bit more about that. We met with the local governments. Marquette County is a quite new county, largest county in the state geographically. And then we met also with economic development groups to understand. And you can see the issues on the left, climate and health concerns that were identified by the various groups, and with the different perspectives that they brought to the issue that helped us come up with some of the policy and recommendations for moving forward. Next slide. Some of the primary concerns, at least up in their area, that were perhaps similar to some of the issues you might be experiencing in your community. Certainly flooding from these extreme events, water quality. They had some issues with high bacteria counts in the water that was kind of unheard of in Superior, Lake Superior. And ironically enough, a lot of the communities away from the lakeshore, there's aquifer. They get their water from aquifer. Some concerns with aquifer contamination or water shortage there. And what happens in extreme events when road access is limited? Some of the wildfires that have been taking place, both in the UP and the air quality issues from the fires out west that were impacting air quality in Michigan. Some of you might remember that. This idea of vector-borne disease, think of mosquitoes and ticks, and that came out secondarily later on as ticks and air quality as important secondary issues, something that they hadn't experienced until recently in some issues that needed to be addressed. The picture on the right just shows some of the graphics where we came up with design interventions and how those issues were integrated into the design elements. So from the end user perspective, this was some community improvement type of opportunity, but we used these design interventions to integrate these concerns, and we had sample policy and health measures on how they could be addressed. Next slide. The other aspect here is phase 2 is that engagement of community and development. We mentioned being able to engage, educate, and identify key components, bringing the community along. I mean, we certainly could have came in with this elaborate plan, but as I guess we've learned from community development, that you have to bring your audience along with you. And climate change is certainly one of those things. There's educational, teachable moments, and from our own experience, we need to express our thoughts and doubts, quite frankly, and be able to address those. And getting folks in a room together or virtually like this is very important to that process. Next slide. In Marquette, we used a number of before and after visualizations where we actually went around to 16 different sites or used those sites. We went around to a lot more sites than that, but we used posters and opportunities. Things were displayed at Northern Michigan University and at different venues around the county, as well as when we brought folks together for the workshop. And we had numerous opportunities for presentation, and our local extension office used that opportunity to engage others at various meetings Emily will be talking about. Next slide. The other thing we used on this visualization is using a number of these local examples and a before picture and an after picture. And what you see, the post-it notes were actual comments that people wrote literally on a post-it note, put it on the picture in a big design workshop that we had, and around tables where they were looking at some of these issues. So we had an opportunity for folks to express their opinions and then for us to incorporate that. This is common in design workshops, perhaps less common in climate health discussions. So we use a lot of design elements, and our faculty and students within our School of Planning, Design, and Construction at Michigan State to be able to help basically create these. Next slide. Let's talk about phase 3. And for that, in prioritization and implementation, that's really where we then developed sector-specific work teams, came together with those work teams, and tried to work out some realistic short, medium, and long-range goals and action steps to move the agenda forward. Next slide. And then being able to put together monitoring update and keeping it active. So having metrics, how are we going to measure success? I think this is really key. And we use some of these health metrics that took a lot of research and local input, and that's highlighted in the guidebooks on the link that I mentioned earlier on how you can measure success if you're moving forward. Now, this all depends on good data. And sometimes the data we have doesn't necessarily highlight the things that we want to measure, and the things we want to measure we don't have data for. So some of that is the challenge, but the key is to be able to put some way to monitor and evaluate this over time. Next slide. The other thing I just wanted to highlight is you see a lot of visuals here, and where we use before and after images on sites. And these met other goals that the community had identified as well. And so, if you were doing a urban design type workshop without even the climate health aspect to it, some of these are just good planning and design practices, yet we use that opportunity for the revitalization, redevelopment of some of these sites to integrate in these climate health, cost-effective type of solutions. So some of the design tool aspects that we think are important here, adopting those cost-effective solutions, really demonstrating those co-benefits of some of those other goals that might have been identified in the community master plan or economic development goals, and integrating climate health solutions into that, and using local examples so that you're actually taking a site using local vegetation, the local landscape perspective, and coming up with some of those examples, and then just making sure you have a wide variety of images to be able to work with. Next slide. Now I'll turn it over to Aaron Ferguson.
All right, hi everyone. Thanks, Wayne, for that overview of the guidebook and our work in Marquette. As mentioned in the beginning, I'm Aaron Ferguson. I manage the Climate and Tracking Unit at the Michigan Department of Health and Human Services. Next slide, please. And so just to give a sense of what the Climate and Health Adaptation Program is and how that relates to CDC and then the work with MSU, just wanted to give this sort of sense of that the Climate Health Program has been operating for a little over 10 years now, and its primary funding is from the CDC Climate Ready States and Cities Initiative. And really, we've been focusing over the last 5 years on this climate health adaptation and monitoring, which was focusing on implementing interventions or adaptations to really assess if they're effective at increasing adaptive capacity to climate and health impacts. And so really that's the work that we've been doing with Wayne's team in Marquette and now in some other communities, is to look at how do we integrate climate and health concepts into other existing community decision-making processes, into existing community planning processes, so that way decision makers can understand that it doesn't have to be a separate process. What we're really talking about is integrating these better perspectives and metrics into these existing work that communities are already undertaking. Next slide, please. And so really our program utilizes this building resilience against climate effects framework that was developed by CDC to help public health departments at the state and local level to think through what does climate change mean for our jurisdiction, how are different communities vulnerable, what populations are vulnerable, how will a changing climate change different health outcomes in our state, and can we prioritize those, and then really developing some plans and implementing them, and then as I mentioned, evaluating those to increase the literature out there so that other communities can kind of test this process. So this BRACE framework really informed a lot of the work that we did with Marquette and with the statewide guidebook that we created. Next slide, please. So kind of the foundation of where we started really in the BRACE framework, and I wanted to take some time to share with this audience, and many here might be familiar with how the climate is already changing in our region and in our state, but I think it's a good place to start with any conversation, is that our climate is already changing. There's already a measurable difference in average temperature and precipitation. We've seen an increase in that average temperature across the Great Lakes region, and in Michigan specifically, we've seen an increase in precipitation, and we've also seen an increase in heavy precipitation events and a decrease in frost-free days. So, really we can see that our system has changed here. I like to think about climate change kind of connecting to the 6 Americas, that climate change in and of itself isn't negative. It's that our systems and our communities were not designed for the type of climate that we're seeing now. And so really our job is to, from an adaptation perspective, is to prepare our communities for these changes that we're already experiencing, and then those that we may experience going forward. Now, I will add that MDHHS, we do view climate mitigation, or the reduction of greenhouse gases, as a primary prevention strategy. And so we recognize that we want to reduce the amount of climate change occurring to try to limit the amount of impact happening on communities, but also recognize that it's imperative that we look at our systems and our infrastructure. Next slide, please. And so kind of tying into that, how we think about vulnerability to climate change, there's really 3 kind of key areas. And again, this is a graphic and a description from the guidebook and something that we talk with communities about. And the first is exposure. And that really kind of goes back to that last slide, is what type, how severe and how frequent of climate events is your community or your area going to experience. So each community, geographically, its different characteristics are going to be experiencing climate change slightly differently. Urban areas could, see more issues around heat because of the density and the imperviousness of those communities. Rural coastal areas may experience different types of flooding events, and we'll get into some of those issues and what that means later. But that's really what we consider under exposure. Sensitivity is the characteristics of the population in a community, of some of the other variables in a community, the type of housing, the age of housing, the different infrastructure that's already in place. What is the age of the population that's there, and where are they located? Is it, what are the socioeconomics? Is it more of an impoverished community? Is it a community that's experienced systemic racism in the past, and pulling in that equity piece? And that's an important concept that we've really been trying to integrate into this vulnerability work, is thinking about justice and equity and some of those historic and ongoing issues that have marginalized certain communities. And then sort of the third factor, which can modulate the vulnerability of a community, is adaptive capacity. And really that's looking at what existing resources, capacity does a community have to deal with these issues. And so in thinking about Marquette, we were looking at a community that had some existing adaptive capacity through the plans that Wayne mentioned that were already there. But what we recognized and worked with the community on was adding that health and equity component to their work. Next slide, please. So in Michigan, these are kind of the 5 health-related impact areas that our program has identified that most of Michigan will be thinking about, and that we've designed a lot of our program work around. Next slide, please. And so I'll go through it in a little more detail, some of these areas. So our air pollution, our air quality can change due to climate change, increased heat in areas, especially urban areas where there's existing air pollution, and smog issues can create concerns around air pollution. So people that are more vulnerable are those with pre-existing conditions, folks with asthma, heart disease, or other types of those pre-existing conditions can be more susceptible to this air pollution concern. And just to kind of give an example of what does this mean in Michigan, or how is this impacting Michigan, there's the Michigan Department of Health and Human Services asthma program has estimated that about 11% of adults and 13% of kids currently have asthma. And that has almost a $92.5 million cumulative impact on an annual basis in Michigan. So you can see that health economics connection, and that as we're thinking about new plans for our city, economic developments in our city, we should be taking things like air pollution through transportation, industry, different things like that, and thinking about how can we improve those conditions, especially as climate change also creates an impact. Next slide, please. Extreme heat. This is one I think nationally that gets most of the attention. Some folks might know that in 1995, there was a massive heat wave in Chicago. And that was really one of the early sort of canary in the coal mine moments for climate and health in the Midwest to recognize that extreme heat is not just something that's experienced in the South and Southwest and other parts of the world, that it can happen here. And in that case, there were thousands of additional deaths and hospitalizations from this extreme heat event. And the city, was very unprepared, and most of our cities are really unprepared for a massive event like that. So even though it's not maybe the top of mind in Michigan, and often we welcome, some warmer temperatures here, there is some cause for concern. And currently there was a study done in partnership with the University of Michigan and our climate health program that estimated, right now there's about 33 additional deaths per year, which it has a sort of total cumulative economic cost of about $42 million a year. If the climate projections are correct, we could see an additional 240 deaths per year with another $280 million impact annually. So I don't share that to like scare folks. These are things that we can prevent by using some of the strategies in the guidebook. And that's really where we want to focus going forward. Next slide. Extreme weather, Wayne kind of went through this pathway nicely, that pathway diagram. But this in Michigan means a lot of different things. For this slide, I chose to focus on some of the flooding issues. Over the last couple of years, we've had quite a number of major flood events across the state. And some folks may also equate that with some of the high Great Lakes levels. that we've been seeing, we know that the Great Lakes levels are cyclical, and the connection to climate change and that increased precipitation is sort of unclear. But what we do know is we are seeing more precipitation, and we are getting more of that precipitation in heavy downpours. So you can see sort of across the state from West Michigan to Southeast to the Upper Peninsula that there's been, large flood events. These continue to occur. Southeast Michigan sees flooding regularly, and these flood events happen in both urban and rural communities. It may look a little bit different. Sometimes in the urban communities, we're talking about stormwater infrastructure that's inundated and sewers back up into people's homes, streets flood, wastewater treatment plants overflow. In rural areas, that can be more river flooding, lakes overflowing their shorelines, which can have an impact on people as well, and septic systems. So this is an issue that does affect both urban and rural communities. Next slide. And that sort of leads into this contaminated water perspective, or the waterborne disease issues that Michigan may see. I think one of the most glaring examples of this was the harmful algal bloom that happened in Toledo in 2014 in Lake Erie, which caused a lot of issues for drinking water. They had to basically turn off the drinking water system there, which affected over 400,000 residents in Michigan and Ohio for several weeks. And we're now starting to see harmful algal blooms happen even in northern inland lakes, and there's a concern around harmful algal blooms in Lake Superior. A lot of that has to do with the increased water temperatures that we're seeing in those lakes. And as we see more heavier downpours, that's leading to more runoff into our water bodies, which takes with it different nutrients and contaminants, which leads to these algal blooms. So again, this is becoming more of a statewide issue. Next slide, please. And then sort of on, we call these vector-borne diseases, and vectors are really these disease-carrying insects and rodents. And there's a few ways this is happening. I think one of the most glaring examples in Michigan has been the spread of the black-legged tick that carries Lyme disease across Michigan. Maybe even as recently as a few years ago, this was not really a concern for most of Michigan, but we've seen kind of a west to east expansion of the zone where these ticks exist. And so the Michigan Department of Health and Human Services is kind of tracking this, and they do testing in conjunction with MSU. And we've been doing some training with local health departments who, a lot of them are not prepared to do some of the surveillance necessary for ticks and mosquitoes because it hasn't been an issue until more recently. And there's also the mosquito-borne diseases like West Nile virus and Triple E that we've been seeing pop up more and more in recent years. And the thought is that our climate is such now that these pests are able to spread. Also people are, as we have less frost days and more people are outside, there's more opportunity for exposure as people are out and about, which is great. And again, that's not to be a negative. We just have to think about it in our planning and decision making, that this is a new issue that we'll have to face. Next slide, please. And so I kind of want to end my talk with a higher level perspective even, and that is that under Governor Whitmer, climate action has become more of a priority across all of state government. And last October, she announced the Michigan Healthy Climate Plan, which really set the climate mitigation goal for the state. And that high level goal is to be carbon neutral economy-wide by 2050. And there are several interim goals. There's some other really interesting pieces that came with this executive directive, including asking Treasury and the Michigan Public Service Commission to think about how does a transition to more of a carbon neutral economy going to affect certain communities? How is that going to impact jobs? To try to plan ahead for that transition and help communities be prepared. And then also asking EGLE, that's the Department of Environment, Great Lakes and Energy, and the Michigan Public Service Commission to start including in their assessments of the utilities plans, how do their plans impact that 2050 goal? How does that impact environmental justice and health? And those are really new concepts in that utility assessment process. And so I think those were a couple of the exciting pieces of this. Next slide, please. And then another of the big pieces that came out again in that October 2020 timeframe was this executive order that created the Council on Climate Solutions. And this council has met twice now. These are publicly viewable meetings, all Zoom, of course, at the moment. So if you go to that link there, you can see more information about the council, how to view it. You can see recordings of previous events and the minutes from those meetings. One thing that I wanted to note is that there are 5 work groups that have been formed to support this council. And listed here are those 5 work groups. I do believe that the sign up that is still open for any of these work groups. So you can go to that link and select work groups that you might be interested in and submit that. And the chairs of those work groups should be reaching out to folks, I would say within the next couple weeks, about getting going. And the idea is that this council will develop a plan by the end of this year that is going to get Michigan to that 2050 goal of carbon neutrality. So this is a really exciting process. It's brought together a lot of interesting technical experts from a lot of different arenas to kind of debate and think through this, and really be solutions oriented, which I think is important. This is a time when Michigan can really be a leader in taking on this work, and frankly, the communities and at the community level has really led the way, and so now the state has to catch up and provide those resources for more communities to take on this work. Yeah, and so with that, I will turn it over to Emily.
Thank you, Aaron. That was a really good overview of the state level. So my name is Emily Leach. I'm a planner with Marquette County, and I'm also the chair of the Marquette County Climate Adaptation Task Force. And I will focus on some local examples within Marquette County throughout this climate and health adaptation planning process. Thank you. So local engagement mostly occurred through the steering committee of CADF, as I'll call it from this point forward. Once again, Marquette County Climate Adaptation Task Force. And there are multiple groups within the county that work on climate adaptation and climate mitigation, including these listed: Transition Marquette, Superior Watershed Partnership, CADF, and Citizens Climate Lobby, the Marquette chapter. And as mentioned by Wayne, there were already a few climate adaptation plans for various levels, city-wide, county-wide, and also the whole Lake Superior Basin. So where there was this foundation to work off of for this climate and health focus. Next slide, please. So CADF was established in 2013, and its mission was to help local leaders and the general public to think proactively about the effects of climate change, and then to develop strategies that will make not only Marquette County, but also the whole Upper Peninsula of Michigan more resilient and effective when dealing with the consequences of extreme weather events. And as I mentioned, CADF was identified as the local steering committee for the Climate and Health Adaptation Program within Marquette County. So go back to the member slide. So CADF has all of these members listed and more, but it is a multidisciplinary forum who consist of local government, some of the local utilities, educational institutions, Marquette County, the Community Foundation of Marquette County, to bring in that philanthropy piece, and the health department. Next slide. So it's really important, to have this multidisciplinary group to collaborate together, because climate issues, it's not just, this easy cookie cutter environmental issue. It brings in all these different populations and issues that are affected from of climate. So local engagement through CADF, we meet quarterly, so it's not a large time commitment for bringing these various groups together, but we do communicate via email throughout the year. We have a steering committee and a membership committee to help boost our engagement throughout the county, but formally we only meet 4 times a year. And we do have different project and program work groups that help to move various projects forward. We do have a website. If you'd like, it's on the Superior Watershed Partnership website, /CADF. And we do take minutes at all of our meetings, and those are also on our website if you want to check them out. So CADF really provided this kind of, professional countywide perspective and sounding board for the project. Kind of a semi-formal group. Once again, we're not any formal organization, but we do, provide some basic organization to move these projects forward. Next slide, please. And then specific to the climate and health project, local engagement in terms of coordination occurred through Michigan State Extension and our local educator, Brad Newman. So MSUE really pushed the project forward beyond what CADF could do as an organization. So they helped with the ongoing interaction, not only with local officials, but with various stakeholder groups. They already have an established network of local government officials that they communicate with regularly, and then this connection to broader MSU resources. So as mentioned before, the Climate and Health Project first started with these initial focus groups and then moved on to a larger workshop that was open to the public. So the focus groups were sorted into these 4 sectors here. So climate change, local government, health, and vulnerable populations. So each of these groups were met with individually before moving forward, bringing it to this larger workshop. Some early implementation that occurred throughout this planning process was a county water coalition was established. And county water coalition was an idea that was thrown around for quite a few years before this planning process occurred, but then kind of fizzled out. And really going through this climate health planning process revived it. And I helped to coordinate the water coalition, and it's comprised of various municipal leadership, the health department. We have the Eagle involved, as well as Superior Watershed Partnership and the local university. The health department created a public health response plan to flooding. And then, as mentioned before, ongoing dialogue about tick prevalence in the area and potential spread of Lyme's disease. Some other great local examples, and I'll dive into more detail on a couple of these further along here, but rain garden construction within the city of Marquette, We have a couple different groups that are also CADF partners working on some of these projects. So rain garden construction, there was a large initiative through the community foundations across the state. They called it the GLOW initiative that helped support funding to address extreme weather events. And the Superior Watershed Partnerships, Great Lakes Conservation Corps partnered with our local community foundation to fund some rain gardens at public spaces. One occurred at a school within the city, and also at local residences. Within the city of Marquette, there was an expanded non-motorized network, signage, and also a bike lane was added on one of our main corridors in town. And then also adding some of these climate and health strategies into local master plans. Quite a few of our local municipalities are currently updating their master plans right now, as well as the County of Marquette. So these strategies that occurred through this multi-year planning process, the timing worked out really well to then include them in these master plan updates that occur every 5 years. Okay, so now we'll go into some more details specifically about Marquette Township. Marquette Township is just west of the city of Marquette, west and north. And our main corridor, a lot of people call it the strip. It is just along US 41, the M28 corridor. It's where a lot of our big box stores are. So they were looking to reimagine this stretch of highway and integrate these planning and design elements with a climate and health focus. So as I mentioned, the first phase of the climate and health process, we met with these individual groups, but then the next phase, we opened it up to the public and actually met at the Marquette Township Hall and had about 40 or 50 people attend, and did a couple of fun activities together where we put sticky notes up on the wall and asked a few different questions. So the first question we asked was, what are you proud of about this focus area? As you can see from this word cloud, these are all different examples of what people are really proud of. What's occurred in the last few years. It's this big gateway for recreation and business. A lot of improvements have occurred within the last 5-10 years to this area. Next slide. The next question we asked was, what are you sorry about for the project focus area? So that stretch of US 41. Pedestrian safety is a huge issue there. It's a highway. There's limited crossing for pedestrians. On either side of the road, you have multiple stores, but the main way to get to them is by car. Median maintenance, so the little strip of mostly grass between the two sides of the road. There's a lot of weeds and whatnot. There are stormwater issues that have been voiced over the last few years. What happens with those surfaces and all the parking lots to the streams close by. Lighting, utilities, lack of deceleration lanes, and snow removal. Snow removal is always a big issue in Marquette. And then the last question we asked was, what would you like to see if you were to float over this site in a hot air balloon 15 years from now? To kind of really get that community visual. Green infrastructure was a big response. Safe pathways, a lot of that related to walkability, crosswalks, added lighting, sustainable businesses, better traffic flow. Next slide, please. So these were the themes and design concerns considerations that came out: connectivity, aesthetics, revitalization, and placemaking. So, all of these considerations are, good to consider in any planning process, but especially for, a section like this highway. So now we'll take a little deeper dive into connectivity. So out of this community engagement, it was recommended to improve trail connection with US 41. So there are multiple bike trail systems, which are key assets to our community in Marquette. Recreation and tourism are large to our not only local residents' quality of life, but also to the economy and the tourism economy in the area. We have the Cayman Trail Network, and their Forestville Trailhead is not too far away from this identified section of highway, and also the Iron Ore Heritage Trail, which is trails, gravel, bike path, and improved trail design and amenities. As you can see, the climate health concern primarily is air quality, and there's obviously all of this is connected, so you can make the case for air quality, water quality as well. Next slide. Okay, so now we'll go into a couple examples here, give you some visuals. So this first site, you could see it's a basic trail with some gravel aggregate there, and on the side it's washed out from rain events. Nothing too exciting, just kind of some overgrown grasses on the side. Next slide, please. And then, a visualization of what this could be. So better pervious pavement to hold that down in extreme weather events, some signage, rain garden off to the side there. You can see where the water would flow. That would help to mitigate some of those erosion issues. Multimodal here, you can have walkers and bikers, place for people to sit. Next slide, please. So once again, this would help with flooding issues, water quality issues, and air quality to increase the non-motor vehicle traffic. This project I'm very excited about. So it's kind of at the upper end of their project focus area. If any of you are familiar with Marquette, we did add a couple of roundabouts in the last few years. So this is up by Target and Riverside. There used to just be access for snowmobiles and bikers and hikers. You would have to cross the highway. So we would have snowmobiles in the winter just zooming across the highway, and the lighting's not very good. There definitely were fatalities throughout the years. But now there's this new edition of what is called Pete's Pass, and it's an underpass under US 41. Next slide, please. So that was the before picture during construction. And ideally, what Marquette Township would like to see happen here is, clean it up a bit. Add a rain garden, kind of in the low-lying area there to help filter the water through. Once again, this pervious pavement. Next slide, please. All right, and then here we have another example. So this is similar area here. You can see Target there, and then this is one of the roundabouts I was discussing earlier. So median here, keep that depression, and you can see here that that's where the water would flow straight down into that depression. So next slide. Once again, add some green infrastructure and some native planting to help filter that water through, get it off the pavement and into these median areas. So short and long range planning. Once again, most of these examples we provided here with the pictures were from Marquette Township. I did include some examples from City of Marquette and elsewhere. But the master plan of a municipality as well as recreation plans are really important to include these climate and health considerations as well as the visuals. It's really, really good for different groups, not only the general public, but economic development groups, nonprofits, whoever may be applying for grant funding to utilize these other plans specific to the township. And as I mentioned, they update these plans every 5 years. The County of Marquette is also going through a large comprehensive overhaul. We haven't done that since the 1980s, but next month we're releasing our county's master plan for public review. And some other plans to consider specific to climate and health. All communities are required to have a mitigation plan, a hazard mitigation plan, and that is also in Marquette County's case specific to the county level, but each of the 22 municipalities within our county each have a profile sheet on their specific mitigation measures they could take to mitigate extreme weather events. And if they adopt the plan, then they're eligible for FEMA hazard mitigation funding. And then recreation plans, those are also a plan that open up funding opportunities through DNR funding. So this, definitely things to keep into consideration. You can reference local plans in, in grant applications to open up funding. Next slide. And then once again, here are the guidebooks that are also a great reference as well.
Thank you, Emily. That was fascinating. And Aaron, thank you so much. The data discussion was very interesting. And Wayne, of course, your climate adaptation guidebooks are very inspirational. So again, thank you for the time putting together these presentations and sharing your experiences with our audience. And we have quite a large audience today. We have a few questions that have come in. And so I'll remind the audience again, use the Q&A button if you would like to ask anything of our panelists, and I think we'll be able to get to them. So I actually have kind of a question I believe all of you could address. Do you feel that most Michigan communities are adequately concerned and prepared for climate adaptation planning, and why or why not? And I guess I ask that of all three of you, if you would like to share your thoughts on that, on how prepared are we for this new climate adaptation planning?
Yeah, Armin, and that's a great question. I'm glad someone was asking that. I started looking closely at this about 7 years ago, and when we had a GLESA grant that Aaron mentioned, and we were doing the work up in the city of Marquette to be able to put together a climate adaptation plan. And I was surprised at how few climate health related issues, climate in particular, were just not addressed, totally absent from policy guides such as the master plan and so forth. Now that's increased, and some organizations, Aaron could probably point to that have tracked some of that. But I think the disconnect has been between understanding the context of climate and health and how it does relate to some of the everyday policy guides that are done at the local level. Like Emily mentioned, the recreation plan and the master plan, as two documents, or your community and economic development plan, if you have an economic development strategy plan. How are these components, and they don't have to be one-offs, how can it, I think as I mentioned in the design side of it, into the question of preparedness, how do we just begin to integrate some of these issues into what we're doing already and that are of importance to the community? I think it's important not to make them stealth. I think it's important to have the educational and teachable moment to say, okay, we're accomplishing, our economic development goals, and here's how we're also addressing, our climate health goals, with some of these improvements. So, I think the concern level, when we look back at the 6 Americas and that slide that I had, which talked about whether you're an alarmist or dismissive, I think that has moved more towards concern in Michigan and certainly at the national level. But I still think the preparedness is really not been addressed well in many communities. And whether you look at some of the recent events that were technological, such as in Midland, the flood there, or some of the other events that Aaron mentioned, it seems like we're really just playing catch up in most of these situations rather than having laid those out. But I'll defer to the other panelists to weigh in on this too.
Well, and that's a good comment there, Wayne, because in our very first session 1, where we had Timothy Little from FEMA's Region 5, he explained, and so did our partner from the City of Grand Rapids Emergency Management Department. They both explained that we are in this mode of playing catch up because we are being inundated with so many climate events and COVID, of course, and the pandemic. So we really are behind with that type of planning, and that nearly all of the county hazard mitigation plans in Michigan are expired. And so it is that catch-up game right now. So I agree. Emily or Aaron, how would you like to address that question?
Yeah, so I can't speak for all Michigan communities, but I do know specifically in Marquette, the strength has been CADF, the Climate Adaptation Task Force, to have this group, that's been established for nearly a decade already, and have that local collaboration occurring. Because a lot of these issues, as I said, it's not just an easy issue to tackle. You need to look at it from all these different perspectives and see how you can make those connections together. So I guess that would be a recommendation to other Michigan communities, is to, if you don't already, try to establish some sort of CADF-like entity, even just to keep the conversation going via email or whatnot.
I agree, right? To work regionally, work with across sectors is so important. Aaron, please.
Yeah, I would say largely the answer to our Michigan communities prepared enough to handle these resiliency questions, and by and large, probably the answer is no right now. And I think part of that has to do with getting the climate data in a way that a lot of different professionals can use it. So if we think about our design and engineering of infrastructure, a lot of those standards are based on climate data from the 70s, and they're just not reflective of where we are now in terms of precipitation and other issues. There's a resource out there called NOAA's Atlas 14, and NOAA is the National Oceanic and Atmospheric Administration. It was a resource. It's in and of itself kind of older now, but it was sort of, it's probably the best resource that I know of that tries to integrate some of the how our climates have changed and how we need to be redesigning our infrastructure based on those. So I think that's a big push, is getting students that are coming through engineering schools, design, architects, even from a public health perspective, just getting that data and training up and coming professionals and current professionals to be looking at our scenarios differently is important.
Well, thank you for addressing that first question. We do have a few more questions to address. So what's interesting is in hearing all of you answer that issue of how prepared are we for climate adaptation planning. It's inspirational that the United States Economic Development Administration is funding this webinar series. And so they, as an entity, are looking for more adaptation planning, resiliency planning. We frame it here as resiliency planning to occur in our economic development policy documents. And those are mainly found at the regional level with those comprehensive economic development strategies. And so that just creating that policy document over the years has taken a lot of partnership and a lot of regional entities to come together. And so it's really, it's impressive that the EDA has made this now a directive to incorporate this type of planning into economic policy. So,
Harmony, I just want to kind of mirror that now's our time. A lot of communities might not be prepared, but using this COVID relief stimulus funding, there's a lot of opportunities coming online, and a lot of conversations happening, a lot of reflection has happened over the last year, and now definitely is a time to kind of get everyone together and really figure out how we can become more resilient in our local communities.
Yep, good point. Good point. So the time is now. We have more of a technical question here, a couple technical questions actually, and we're thinking this is for Aaron, but let's hear it. Has a survey of climate concern or skepticism resulted in any assessments of how communities are varying in their attitudes across Michigan?
Yeah, I think, and I'm guessing this sort of ties back to that Six Americas point that Wayne was talking about. And we haven't, at least our program hasn't done sort of that statewide assessment. We've been using that approach sort of with some of the individual communities we've been working with. But a couple things that might be out there though. Around the last election, there was a lot of polling done on climate and environmental issues to kind of judge where communities were, and there was a lot in Michigan, and it did show an increase in concern and a higher priority for climate and environmental issues across Michigan. I haven't seen that broken down by county or community yet. We are in the process of working with some partners at U of M who did a survey of local health departments in Michigan to gauge their perceptions and awareness of climate issues and climate resources that are out there. And so that'll be published fairly soon. And I think it's fairly telling that even though we've been working on this for 10 plus years at the federal and state levels, there's still not as much awareness around resources that are out there. So there's definitely still more work to do. And part of that is finding the right messengers. I think our message is fairly good at this point, but we have to do a better job of engaging different messengers that are trusted voices in different communities and to different groups, and training them to go out and share these perspectives. So that's something that we'll be working on.
Again, another good opportunity coming up, right? So another technical question is wind being measured as a trend. Wind has been creating flooding and erosion without rain events, and the frequency and strength has been perceived to be steadily increasing. Any comments on wind as a study, as a trend in your work that you're doing?
That's an interesting question. I would have to kind of defer to our partners at GLESA. That's the Great Lakes Integrated Science Assessment Team. I can ask that question. We kind of rely on them for a lot of those more exposure metrics, those climate related metrics. During the high lake level work that we've been doing, we were very aware that a lot of the issue was around coastal erosion and storm surge and things like that. But wind specifically isn't something I'm aware of, but I'm happy to ask.
Super. And I just put a link to Glisa's page in the chat for anyone who's interested in doing a little bit more self-research on that. Let's see here. Next question. Where do people look to find catalogs of ideas that could be implemented to improve resilience while simultaneously reducing cost and solving multiple other local problems? So where's that catalog of ideas?
Oh, one of the resources there, even though the guidebooks, volumes 1, 2, and 3 were based on or focusing on the issues in Marquette County, we scoured basically not only state resources but national resources to be able to identify what was out there, and so I think that's a good catalog of resources. If you go into particularly the volume 2 that has both the metrics and the policy, and then the sources at the end. Also within the guidebook, the generalized guidebook that we started out with the presentation here today, in the back of that document, there's a whole several pages worth of some of those resources as well. And Aaron, I know some of those we drew directly from your office and some of the things that you've been working on and publishing over the last few years.
Fantastic. And I did put a link to the guidebook and the climate adaptation page at the top of the chat. I just put it in again, so it would be more easily accessible to everyone here today. So yeah, go ahead.
I would just add to that, specific to mitigation, county hazard mitigation plans are a really good spot to look for kind of a catalog of projects. They all have, strategies to implement specific to, projects, on the ground projects that could be done, and they take into account, human health and casualties that could be reduced or eliminated, and also, costs to implement those projects, as well as capital improvement projects at the municipal level. So those might be two options to kind of, get different lists to look at and compare.
I'm glad you mentioned that. Oh, a little bit of feedback there. So yes, the county hazard mitigation plans. I also put a link to the state hazard mitigation plan in the chat as well, with a wide range of tools there available, and the author of which is actually in the audience today. So absolutely, capital improvement plans and hazard mitigation plans offer a lot of tools. Let's see, do we have any more? I think we have one more question. And again, we have time, so I invite anyone out there who has anything they'd like to pose to the panel to just drop your question into the Q&A button there. So looking at costs, has there been any economic measurements on climate adaptation or resilience design and how it might enhance the local economy short or long term? So an economic feasibility or an economic study of these measures. Any experience you've had with that type of work?
Yeah, I would say out there, we looked at some of that when we kind of launched down this pathway, and there are nationally some research that's been done to link what we call co-benefits of doing this climate adaptation work to other community benefits and economic development. And so there is research out there. I think overall, climate adaptation and then resilience is a fairly new field. Is compared to mitigation. There's at least a few decades of experience when it comes to mitigation. Adaptation is still relatively new, and it's still kind of an emerging field. But there is some work being done out there, and I can try to provide some links. I think there's sort of linking to that last question too about sort of a clearinghouse for things. There's a resource called the U.S. Climate Resilience Toolkit, which was created sort of at the end of the Obama administration, and hopefully will be updated now, but that has a lot of really good resources. You can search by region and topic and different issues and pulls up lots of resources from sort of local to national level. So I would encourage you to sort of explore research in there, because I think there's a lot of material that you would find on that topic.
Yeah, thanks. And if anyone in the audience wants to watch the recording of session 2 last week, Rex Lamore did offer a couple models for doing your own research and assessing the economic benefits of various resiliency projects. So there are tools out there. And also in the chat, Mr. Stanton in our audience had offered a look at the Maryland 2030 Climate Action Plan, who actually does that economic analysis. So thank you for that, Tom, and thank you, Aaron. All right, we have a couple more. It looks like we are wrapping up our questions. We might have just one or two more, but it looks like they might be more comments. Oh, here we go. For those of us without access to advanced design technology or without the experience, what suggestions do you have for resources that they could use to create visualizations like what you had created for your documents?
Yeah, well, I'll jump in there. Well, first of all, the visualizations that you saw, I mean, those were done by students, design students, specifically landscape architecture students, and so, you know, Photoshop basically of taking an existing site and then using some of the best practices based on the research and integrating those in. So, you know, I don't want to say it doesn't take any experience, but it's certainly, our universities around the state are a wonderful resource for that, to be able to provide, you know, that opportunity. And many times the faculty and the schools, you know, like our School of Planning, Design, and Construction at Michigan State are eager and willing. I mean, we are fortunate that we have a statewide program called our Sustainable Built Environment Initiative, SBEI, and that was the overarching program that did the before and after imaging that Emily shared and that we had in our guidebook, and working with communities. So I would say, you know, the experience has been, and even at the community college level, there could be, you know, folks that are, you know, using some of the basic Photoshop techniques that can be guided through a local expert, you know, could help pull some of those together. So I think that there are really cost-effective ways to do some of the imaging, you know, or to use images that explain and show some of those key components that can be done, you know, on a site that have been used elsewhere. But we really did find that using the local examples to be particularly relevant here. But it's a good question to ask.
Well, and Emily made the good point of it's so critical to work regionally and work with your partners. And so that's a good case in point, right? That I know as a regional planner, we were able to create projects, create designs that never would have been able to be afforded or done at that tiny local level with township staff. And but together, to work together in a regional committee, the local governments were able to pool their resources and actually go for grant money together to help support these projects and do it. So it's very difficult to do it alone, I guess, is the story there. It can be done, but it just, why not partner, right? Why not partner? And yeah, Wayne?
Yeah, Harmony, I was just going to add, I mean, a couple of us here on the call, Harmony and I mean, we're instructors for the National Charrette Institute. So we have NCI that's at Michigan State, actually housed within our School of Planning, Design, and Construction. And some of this pre-charrette work that is done, you know, can be led or partnered with our NCI. So that's another good resource to be able to mention. We have not only our Sustainable Built Environment Initiative, but we have for some of the larger projects too, or some of the pre-charrette work, NCI, that can help facilitate some of these discussions.
Yep, MSU and MSU Extension, National Shred Institute. Good point. Yep, we're all there as a resource. Oh, let's see here. We have a few links that have been put into the chat concerning a HUD Green and Healthy Home initiative for people to use as a resource. Check that out. United Nations Sustainable Development Goals link is in there as well. Thank you. The Maryland Climate Plan. Thank you, Tom. We have a question about, again, the impact that wind has on our economies and on our health. I believe we answered that, though. Oh, great. And I'm just looking through the Q&A button here. We have, please remember that Michigan State University also has an urban and regional planning practicum opportunity every spring semester. A small group of upperclassmen and graduate students can be engaged with a local community to provide planning, guidance, research work, including design efforts too. So visit that School of Planning, Design, and Construction website and look up the planning practicum. And I know that applications go out every fall for that. So thank you, Marie Rumenap, for bringing that to our attention. And another comment there about open source design ideas. So thank you again, Tom Stanton, for sharing those ideas. Super. Well, it is 10 o'clock, and I would like to thank all of our attendees for your engagement, for participating in this webinar series, and also to thank our panelists. And I'm going to share a screen quickly here. We have a lot of partners to thank. We're very grateful for our partners. Thank you to the MSU Comprehensive Economic Recovery Initiative, and of course to the EDA for their funding and support, the Michigan State University School of Planning, Design, Construction, and our partners, Michigan Department of Health and Human Services, the County of Marquette Planning Division, National Shred Institute at MSU, and the Urban Collaborators Program. We hope you join us next week for session 4, where we will have a panel. We'll have 3 speakers with expertise in planning for resilient natural infrastructure systems, and they will present tools and techniques and ideas at various geographic scales for planning for more resilient natural infrastructure. Again, that's next Wednesday morning at 8:30 a.m. Registration is still open, so please spread the word. And we have panel information here. John Pascas, Ming-Han Lee, and Asia Downton going to join us from Michigan State University. So have a great week, everyone, and thanks again.